I don't think anybody will argue that the future of cancer care delivery is moving towards a more value-based environment. So really shifting from fee-for-service to value-based care. So what does that actually mean? And I guess the best example is what's happening with the oncology care model. So CMS has already come out with the foundations and sort of a structure for what they're calling Oncology Care First, which is essentially the next iteration of the oncology care model. The biggest difference between the oncology care model, well, and OCF as we call it, and there's quite a few, but what's interesting is that they are actually moving into a prospective fee schedule, meaning that fee-for-service billing is going away. So no longer in this model as it's being proposed today. Now things can change, right? I mean, but as it's proposed today, practices will no longer be billing fee-for-service. They will get a prospective payment per patient based on historical spending. And again, question is how much, et cetera. But that aside, thinking about conceptually what that means for the practice, they really have to know what they're doing. They really have to be able to get their care delivery model down. And that means from A to Z, and the entire care continuum needs to be coordinated. Interestingly enough, navigators will be absolutely crucial to ensuring that that care delivery process is executed successfully. So when you think about, the biggest aspects of that, how are we going to do that? One is, the drug cost, of course, is how do we actually affect the drug cost? The second is care coordination, which is essentially rests on the navigators to execute on. And the third is really understanding the impact of the holistic approach that you're actually going to need to take for the patient. So there are so many aspects to this model that are going to be kind of up in the air, but one thing's for certain, moving forward, not just with Oncology Care First, but with any other APMs. We know that there are other APM models already out there. We know that there are others that are coming. And even the models that I myself and New Century Health are developing in terms of total cost of care models are going to require a level of care coordination that's even more than what we have today. And certainly the navigators are going to be essential to any APM model and its success.